Often we identify with perhaps our profession, even our physical appearance. People's physical appearance can change drastically if their hair falls out, they may lose a lot of weight, not be able to do the activities. If a person was an accomplished athlete, a golfer or a runner, that's gone. So it really can challenge a person's core identity, make them ask those questions about really, who am I? There's a lot of grief and loss. Even if the prognosis is good, there's often surgery, a person might lose a body part or have scarring. You kind of lose that innocence around death. So of course, people have to face the reality that their time here is limited. Again, even if the prognosis is really good, and we know now that 65% of people diagnosed with cancer live 5 years or more post-treatment, and those rates are even higher depending on the type of cancer and the stage. Nonetheless, everyone faces that awareness of mortality. It's really impossible to avoid. And for some people, that can be terrifying, but it's also can be a catalyst or a motivator for people to look at how they live their life and consider, is this how I imagine my life to unfold? Am I living with a sense of authenticity? Do I have meaning and purpose in my life? So it can actually be a catalyst for self-examination and eventually transcendence and more alignment with one's authentic goals. Again, I mentioned the common challenges of the symptoms of profound fatigue, ongoing pain, sleep disturbance, insomnia. It's very common in people with cancer, and difficulties with anxiety and depression, fear of cancer recurrence. So some illustrative quotes: it's changed my outlook on life, especially my relation to myself. How do I live in a body that doesn't feel like mine anymore? So just the really practical, embodied process of regaining an awareness and a familiarity with the physical body that some people may feel has betrayed them and has certainly changed through the course of treatment. So within the field of integrative oncology, we follow a holistic mind, body, spirit model. It's a patient-centered, evidence-informed approach to cancer care using many different complementary therapies like mind-body therapies, meditation, yoga, lifestyle modifications like physical activity, nutrition, and natural health products. So within an integrative oncology model, all these complementary therapies are evidence-based and they're used alongside conventional cancer treatments, as opposed to, say, alternative therapies that may be chosen instead of conventional care. Within integrative oncology, we're finding the best evidence-based ways to bring these together. So the aims of integrative oncology are to optimize health and quality of life, improve clinical outcomes across the cancer care continuum. So from prevention right through treatment, survivorship, the recurrence, end-of-life care, or prolonged survivorship. We want to improve clinical outcomes, empower individuals to take an active role. So I mentioned there's so much loss of control in a cancer journey. This is one way to empower people and give them tools and approaches that they can use anytime they want.